I decided to go to Haiti very quickly. Actually, I received the email and it specifically called for wound care professionals. And as a wound care professional, I think it took me all of 40 minutes to send back my name and volunteer. So there was this general feeling of excitement throughout the plane and as we deboarded the plane. And then you just kind of stand around and there's just total chaos.
It's absolutely pouring. We're hopeful that our tents are going to hold up.
I was going to essentially take over for the existing wound care chief and his team. It was just incredible from the first orientation. One of the tents had all the supplies for all of the tents and the hospital patients in it, and it literally was nothing but a stack of cardboard boxes from the dirt floor and the grass all the way to the top of the tent with homemade tiny little cardboard signs and pieces of paper that would direct you kind of in the right direction as to where the supplies were in these boxes. It was crazy. And then from there, you know, we went into the pediatrics tent. There was 100 pediatric patients on these tiny little army cots, all lined up with maybe 4 inches between all of them. And he races me through there to the back of the operating room where in a tent, there's 4 operating rooms with the equipment kind of pieced together and gathered around. I mean, one of the operating room tables was a picnic table. He races me out of there into the adult tent, which literally had 140 adult patients in it, again, on army cots with maybe 4 inches between each cot. And he takes me into the wound procedures room, of course, room meaning just a little walled off part of the tent. And this had space for 3 stretchers, and it's where we did all the wound care procedures. Little did I know at that very first walk into that room that would be essentially where I would live for the next 6 days.
I'm in my tent with my giant mosquito net over me. There's about 150 people in my tent with me. We have cots. There is water, but there is no food. So good that I brought lots of food, and in particular Oreos. We're following about 750 patients, so it's pretty crazy.
The first thing that struck me was the odor from the tent. I remember these patients have severe, just unbelievably horrific wounds, many of which by the time I got there had some level of infection. And the tent itself was hot. The weather was about 95 degrees with huge humidity, and so the air inside the tents didn't move much. It was somewhat stifling, so there was a clear odor when you entered the tent. The next thing that struck me was just how beautiful the Haitian people are. They're an extremely beautiful and graceful people as a whole. And the third thing was the wounds that were going on when I walked into the wound procedure room. It just was incredible. They were all predominantly trauma-type wounds related to damage received in the earthquake, but huge number of orthopedic injuries and a huge number of amputations, both above the knee and below the knee. One of the worst wounds that I dealt with is what's called a guillotine amputation, where the leg is amputated. There's no attempt to close the stump, and in this particular case, we had a femur bone sticking out. You know, I'm a chronic wound girl, so maggots don't bother me for the most part. But in this case, the burns on the patient's wrist were so severe that the maggots were actually burrowing deep into the tissues on her wrist. We had infected grafts, so grafts that had been done prior to our arrival that just didn't make it. And in one case, a horrific scene when the woman's thigh, essentially where the graft had been placed, just completely opened up in infection, and essentially her leg was filleted open. I have to tell you that the team members were incredible. Most of them had no experience with the wounds prior to this, and so they just took it on. You know, the wound care that we provided to the patients, while necessary, was intensely painful. In the afternoons, usually around 4 or 5 o'clock, you'd be doing your bedside rounds to try to change the dressings on patients, and your patients would all be there with their arms raised in the air, singing. after that singing, the entire attitude within the tent would change, and it would be really difficult to do things as invasive as some of the wound care that we provided. Towards the end, on our final day there, we saw 70 outpatients. We saw patients from sunup to sundown. They were well enough to be out of the tent hospital. We made a significant difference. I was walking through the compound. It was the end of the day, it was about 4 or 5 o'clock in the afternoon, and there's people flying a kite. So there's a little group of people, and here's a kite up in the sky. I just couldn't believe it. It just seemed so hopeful. And maybe I was meant to be there.
It's